the first question I have pertains more to me. It's more of a selfish question because, you know, when you got the guru on here, you gotta actually ask something that's going to pertain to you. I'm always trying to learn. Everybody on here is trying to learn. And in the group that I'm running with Health Insurance Hustlers, obviously people are transitioning. And I know a lot of agents currently right now that are transitioning from health insurance to Medicare. And I know you've kind of obviously done both. So what would your recommendations be to somebody that's done specifically under 65 health insurance to now start to leverage that book in the Medicare space? To Medicare. And I know you've kind of,
bear with me just a second. All right. Yeah. So this is a really good question. We deal with a lot of people who are coming from the PNC side in the Medicare. We deal with a lot of people coming from the group side, trying to cross sell that into Medicare. And the under 65 side, honestly, I think is the easiest one because you're already used to dealing with these people on an individual basis. And so, you know, the low hanging fruit is definitely the T65s, which is, it's crazy to me how many under 65 guys I've talked to that aren't even like going after the people that are aging in the Medicare off of their book. People that are like, refer it away. It's so crazy to me. I mean, don't get me wrong. If you refer those to our office, we will take it all day long. It's one of my favorite referral partners. But for most of you, if you're doing under 65 and you're trying to hedge that way, the T65 is the low hanging fruit. After that, you know, honestly, one of the things I would do if I was in someone's shoes that was doing that and I wasn't trying to just blow a bunch of money on marketing, I would probably go out there and start calling all my clients, no matter how old they are, and just letting them and just checking on them, letting them know that you're Medicare. Because I do believe that the more of your customers that know what you do, I can't tell you how many times we've had customers that came in that bought a life insurance policy somewhere else, a cancer policy, something like that, and it's something that we sold, exactly something that we sold, and we just by virtue of them not knowing. And, you know, those people might have parents that are going on Medicare. You might be surprised to find that some of your under 65 people go on Medicare before they turn 65 because they get disabled and they didn't know that you helped with that. And so there's just a ton of ways to market to those. Another way is, I mean, just going straight out and calling, you know, telemarketed leads, direct mail leads, the same way that you're already building your under 65 book. I think that if you have the tenacity to call and deal with under 65 health insurance, you know, in some ways, Medicare would be probably easier than that, especially if you focused on MedSup for a little while. So I don't know if that answers any of that, but you might have follow up to that, man.
I definitely do because, so one of the things that I train agents on when they're coming into just the under 65, and you say it's one of the easier, you know, easier segments of the market, if you will. Even in that sector, I really try to advise agents to, hey, let's focus on one or two products. You know, let's focus on these one or two big players in the industry, and let's go after that business, and then let's start to add in the other stuff as we go. Would you recommend, and this can just be a short answer, would you recommend an agent that's serving mainly under 65 to just try to take care of the Medigap in the beginning and then maybe transition into Advantage after they've done that for a little bit? Or I would just do both at the same time?
I would say initially, okay, a lot of it's going to depend on the style that you market it in or marketed. If you were marketing under 65 over the phones, I would start focusing on Medigap and then go ahead and take the AHIP for the value that it brings to you, as you know, from a knowledge standpoint, and start, you know, cross selling the drug plans to your Medigap clients. But the reason I would do that is because first of all, the compliance bar is a little bit higher for Medicare Advantage over the phone. So if you're a phone person, that's why I would say that. Now, if you built your business, you know, brick and mortar, or if you built it off of, you know, going to houses, you know, then you could probably have better luck going all in with Medicare Advantage. A lot of that has to do with the type of people you're dealing with when you market those ways. I tend to find that people that do business over the phone, you're going to get a higher percentage of them that are okay with Medigap, in most areas. Obviously, there are some areas, like if you're in Miami-Dade or, New York or somewhere like that, where you're going to get a really, really high, percentage of Medicare Advantage prospects, no matter what their income level is. But Medigap's an easy segue. And then, I'd say write a little bit of that and get comfortable with the Medicare conversation, even if you're not writing the Medicare Advantage. And then once you feel like you're comfortable with the conversation, then start pulling out the Medicare Advantage. It's okay to crawl, walk, and run. You don't have to do everything tomorrow. We've been saying we're going to add PNC to our practice as a cross-sell our book opportunity and an additional marketing opportunity, but it's taken us about a year to set it up because we're doing other stuff. It's not like we can stop. You don't want to do anything that's going to stop one thing that's successful and halt it in its tracks. You got to do it a little bit at a time so you can actually add it. And it doesn't, I don't want one opportunity to suffocate the one that was already working. I want it to be an addition to my practice. So, I don't want to tell somebody to do Medicare and they end up actually suffering in the interim because of it.